Welcome everybody to the Lifeline September webinar, where we are going to discuss crisis center efforts for the National Suicide Prevention Month. We're going to talk about some of the things that the Lifeline has going on, including the hashtag #BeTheOne2 campaign. And then we're going to hear a little bit from at least one center about what they're doing for National Suicide Prevention Month. Or as we have discovered, sometimes people prefer to call it National Suicide Prevention Awareness Month, or Suicide Awareness Month? So we're going to get into that a little bit. But what I'll go ahead and do is introduce really quickly our two guests and co-facilitators. First of all, we have Frances Gonzalez, who is the Director of Communications for MHA and the Lifeline. And she does a lot of work trying to make sure that the campaigns for National Suicide Prevention Month for the Lifeline and for a lot of other things go smoothly. So thank you for joining us, Frances. We also have Laura Mayer here from PRS CrisisLink in Virginia. Is that correct?
Okay. I can hear you.
Oh, you can't hear me at all?
I couldn't there for like 30 seconds.
Okay. PRS CrisisLink is in Virginia, is that correct?
That is correct.
Okay. Whew. That was close. Laura is the program director there at PRS, and PRS is a 24-hour crisis hotline, text line, and telephone reassurance program serving Northern Virginia and the District of Columbia. PRS is a program of psychiatric rehabilitation services, Inc., and exists so that individuals living with mental illness, substance use disorders, mild intellectual disabilities, autism spectrum disorders, and anyone who faces life crisis can achieve safety, personal wellness, recovery, and community integration. It goes without saying that PRS CrisisLink is also a Lifeline Network crisis center. So thank you both for joining the webinar today. What I'll do here, I think at the beginning, is just hand things off to Frances, and then if you can tell us a little bit about what's going on with #BeTheOne2 this year, how is it different than last year, and then tell us how maybe crisis centers can get involved.
Yeah, great. Thanks for that. So the great thing about, you might be familiar with our #BeTheOne2 campaign, but for the communications team at the Lifeline, all of the campaigns and messages that we put out tend to fall into the three key message buckets that we have. So the first two being that hope, help, and healing are happening every day, which was formerly suicide is preventable, which is a message of hope for people that might be in crisis at the moment. And then the second key message is one of action for people who want to get involved in suicide prevention or help someone else in their lives, which is that everyone can take action to prevent suicide. So those two messages with their distinct audiences sort of come together for us every National Suicide Prevention Month in what we call our #BeTheOne2 campaign. So last year was the first it's been around since 2015, but last year was the first major push that we had for it, and it went really well, and we got some really great feedback. A lot of centers participated, and a lot of other organizations in the field of suicide prevention did as well. So it had a really great reach, and we learned a lot of lessons from that. One of the things that we heard back from centers was that what they liked was that they had a lot of different options to participate, but they also wanted some options to be able to brand things for themselves or put their own spin on these materials. So to go back a little bit, #BeTheOne2 is essentially 5 steps that a person can take to help someone in their lives that might be suicidal. So we share the message that you should help somebody all the time if they seem to be in crisis, but we don't necessarily always share how to do that. And these 5 steps essentially break that down into sort of a blueprint that a person can follow to help somebody in their lives with very simple, actionable, and evidence-supported steps. So last year what we were able to do is that we had a really great Twitter chat during World Suicide Prevention Day. We had stories of hope and recovery hosted on our microsite that Chris very kindly posted in the chat window, BeTheOne2.com. And we also had, Facebook Live events and provided a graphics kit for people to participate that listed all 5 steps, which could be posted throughout the month, and also messages for the entire month as well. what we've done this year, taking into account all the different ways that the feedback that we got and what we experienced last year, is that we decided to expand this to create more options for participation. So the way the campaign is designed is essentially to give people as many options as they can to participate in whatever level feels comfortable for them. So right now we have 4 options for participation. One is to use the messages that we have on our message kit on the website right now to post throughout September or whenever they feel like it. The other, and that's sort of our lowest form of participation, and sometimes people are comfortable with that because they want to participate in the conversation, but they don't know what to say, and that message kit helps pave the way for that, essentially. The second option is to submit a story of hope and recovery for us to be hosted on the site. So because the action of Be the One Too is sharing the message that an ordinary person can help somebody in their lives, you don't have to be a mental health professional, we want to share stories from people who have had that experience, who have been helped or were able to help somebody else in their lives. So people can submit stories that would be shared on our site with attribution. The next participation option is that people can create custom kits. So something that came up was that people wanted to be able to brand these materials for their own organization or customize them in some way, which is great for us. The great thing about the Lifeline is that we don't necessarily need to keep everything branded for us. We just want the information to be available and for people to use it. So the option available is for people to take the 5 steps and customize them for themselves and submit them to us. And then that way we would host that kit on our website with attribution and provide it as a downloadable option for people so that when they decide to share those 5 steps, they have a lot of options to choose from. So right now we have kits from the Construction Industry Alliance, NAMI San Francisco, and several others. A lot of them deal with very specific populations, so we're able to really reach a lot of very specific audiences that the Lifeline might not have been able to reach on their own. And then, of course, the fourth option is that we got feedback last year where people really enjoyed the Twitter chat that we hosted, but we're hoping to do more activities like that. So we decided to literally do more. So we have 4 Twitter chats throughout the month of September that allow us to dive deep into the individual steps and educate the public and share resources on what those steps mean, how they could use them, and what other information people might want to share during those times. And individuals and organizations can participate essentially as co-hosts in those events. So those are the main things that we have going on for National Suicide Prevention Month.
Just a tiny amount of things.
Yeah, just a touch, you know.
Yeah.
Chris saw our campaign plan. It's like about 12 pages long.
Yeah. It's super comprehensive, and I think one of the things that made this year so different was the different components on a lot of different levels. So there is the ability to share some of these images, which we had last year too. But like you said, the increased amount of Twitter chats, we contacted a lot of people asking for input on things that they might want to do with us and partners, all sorts of things. So I think just this, like you made very clear, we just kind of ramped things up, right?
Mm-hmm. Yeah, a lot of the feedback was just, more. We want to be able to do more. And the great thing about this is that a lot of these options were suggested to us by either centers themselves or through our Consumer Survivor Committee of people who are active in the field and have encountered trying to use these messages out in the public and have returned to us and say, this is what we need.
Yeah, that's awesome. Cool, and I posted a couple of links down below. One about the date for the Twitter chat. So if anybody wants to jump onto those, for those Twitter chats, do they just follow the hashtag? Is that how that works?
Yep. You can participate in any of them by following the hashtag #BeTheOneToo with the numeral 1. Well, that one always trips people up. And if you want to see how any of those Twitter chats have gone, we have a Storify up on the events page that kind of recaps the first one that we had just this past Tuesday.
Awesome. Perfect. So, Laura, one of the things that we noticed immediately, and I think the thing that we both agreed that we were like, we have to get her on this webinar, was we saw your editorial calendar for the month of September, and just the comprehensive nature of it, the fact that there are so many little pieces to it. We were just really excited. So thank you again for jumping on with us and talking about that. For anybody who wants to look at it, we won't have it up here on the screen, but I did post the link. It's the top link down in the chat box. So if you click on that, you should be able to pull that up. But yeah, Laura, do you want to tell us a little bit about what's going on there this month, and how this month or this year for Suicide Prevention Month might be a little bit different for you all?
Sure. Thanks for having me. So our calendar is really born from 2 previous years of campaigns with a different hashtag, which was called Minds Matter. And we particularly wanted to expand to a more focused population and cause, because Minds Matter really was about mental health, and obviously mental health ties into suicide prevention. But this year we really wanted to focus the conversation on actionable items that people could do to participate in suicide prevention awareness. This is really a collaborative effort between myself, our Director of Development, Meredith Hovan, and our Manager of Events and Volunteers, Lauren Paget, and our super supportive leadership team. Our CEO is on here today watching this. Hi, Wendy. So our calendar, what we were trying to get at is there's a lot happening in our community already around suicide prevention, and these other organizations are doing really fabulous, amazing things. And how do we find a way to incorporate all that good work and promote it and be part of these events? So the first thing that we were really looking at is what events are already on the calendar. We started way back in the spring and focused on how do we spread out activities, actionable items that people can accomplish around these days. So we started some of the walks, which we had already participated and sponsored, and made those kind of our big items. And then we have our kickoff around this T-shirt that we do every year. Every year it's a little bit different. We have this whole collection now of annual T-shirts, starting back from a long time ago about each year's campaign. And we ask people to purchase their T-shirt to then participate in all of these face-to-face events. Not everyone can do that, so we started beginning to look at our social media aspects. So we are talking about different age groups will participate in different things. So how do we reach different demographics? So this year, our big social media part was to add an Instagram account so we can start to hit up youth more than we were currently doing on Facebook or Twitter. And then little tiny things throughout the week. We wanted to incorporate a significant portion of education and link back to organizations doing really awesome things in their health promotion, in their health education around suicide. So we used existing resources versus creating our own for cost effectiveness, and also so that we maintain the theme and congruence of the messaging in place that's evidence-based and aligns primarily with the Lifeline in that, yes, suicide is preventable, but we'll have a part of that, and there's health, hope, and recovery. So really moving the conversation forward beyond prevention. So our campaign has definitely evolved over the past couple of years. This is the first time we've done it over an entire month. And this calendar is really coming from our Director of Development, really trying to make it easy for people to access those items one by one throughout the month. That is the basics. But I will say this year we're adding videos, which has been really interesting. We're recording videos of our volunteers and staff in the call center talking about their reasons for participating. And it's not only awesome for our campaign, but we're actually learning a lot about the people that do this work. And it's been inspiring to us, the community, locally, and I think it really will cross some barriers that we've had in the community for people reaching out, because they're going to get to see for the first time who's actually answering the phone, who's actually answering the text, and why we're doing that work. So it's not necessarily survivors that we're tapping into as much as people doing the crisis work to help others in the community.
And Francis mentioned a little bit about how we tapped some of our committees to provide feedback about certain aspects of the campaign. Did you all do anything similar to that? Where did some of the feedback come from when you were developing this?
So I sit on a lot of committees in our local community. I am very fortunate to have a lot of really great resources, peers and people with lived experience, as well as public health professionals in the mental health field. And so we all kind of work collaboratively in the months ahead in these meetings to talk about what are we doing as a community. And that's where we're getting some of the feedback. And we have stakeholders who have shared with us their thoughts and opinions about current prevention and awareness efforts. And one of the bigger themes that has come out of our community, actually from doing a lot of work on investigating youth suicide, has been in the families of people who have died by suicide are struggling with the word prevent. Because it's always implying to them that there was something that they could have done to prevent suicide of their loved ones. So they're looking for us to incorporate more language about awareness and education. Ultimately, we're coming to the same point where we are preventing suicide, but it seems to them that it's hard to get involved in the prevention community because it's really difficult for them to work through some of that stuff from their loss. So for us, we stayed with prevention as our primary kind of campaign header, but in everything that we're doing in print and on camera, we're including that word awareness so that we're making sure we're hitting these points that are so important to embracing the entire suicide prevention awareness community and not just kind of the education piece of it. That's been really important for cultural competence for us. We're also involving survivors' feedback for the actual events, how they want to be involved, as well as people who may not be as approachable about suicide prevention and awareness, how they could kind of be involved on the outskirts and participate in things that wouldn't be too big for them as they're starting to become more aware and more comfortable with the topic of suicide.
Yeah, that's a big thing, and I know, Francis, yesterday when we were talking, you had mentioned a little bit about how to tap into some of those specific audiences. I don't know if you had any questions about that.
Yeah, I mean, one of the things that I think may not always be apparent is how much work goes into just trying to decide what message is right for a particular group of people and the best way to reach that group of people. And a lot of it is determined, I think, on goals. So I'd love to hear, Laura, your thoughts on how you determine what those audiences would have to be and identified the different ways that you would have to customize that message. Mainly for us, it was that the Lifeline is for everyone. But the problem is when you are for everyone, you also have to talk to and for everyone at the same time. And how do you do that without, one, doing it wrong, and two, customizing what's essentially a very broad message. And so for us, that's where the custom kits came into play, where we could actually reach out to people who have way more experience and expertise in reaching these custom audiences and saying, hey, like, we recognize that you know how to do this better than we do. We have a large platform that we can share with you for this. Help us do this, essentially. And in exchange, we will share whatever you're already working on, because a lot of times these messages are already overlapping. We just haven't put all those pieces together yet.
Yeah, so for us, that was definitely the hardest part, is determining who our audience was going to be for a campaign like this. Because there are so many groups that we're trying to reach, which is why we kind of stay broader, and our focus of our hashtag that we're utilizing here is call, text, live. So our hashtag is a call, text, live, call to action. So we're trying to say to the people in our community, whoever they might be, that these are life-saving services for you, and they're available whenever you want and need them. And what we're trying to get is the people who are not currently in a place in their life where suicide is an issue for them in their own individual scope, to promote the action to the people that they're concerned about. Our campaign is not necessarily targeted at people specifically at risk. It's more to enhance and broaden our scope in our community that this is a safe resource. There's so many barriers to reaching people about what their concern is going to happen when they call or text us, that this is more of an education that's across the board and only about suicide as a whole. Because we live in an incredibly diverse area right outside of Washington, D.C., so it would be impossible to reach every community and every culture through one campaign, so that's why we kind of stuck with that, just the call to action versus a bit more narrowly focused campaign.
Frances, did you have something?
No, I think that's great, and I think it really shows that how you message it really kind of in a certain way kind of self-identifies an audience for you sometimes. Where we may not necessarily know that this will appeal to a very specific group of people until it actually happens. So, for instance, one of the groups that we ended up reaching was a lot of commuter rail, for instance. So we work with Metro North that runs a lot of railroads and Amtrak, and then when we told them about the Be the One Team message, they really loved it because they wanted it for their staff and they wanted it for the public that go through their stations. But at the same time, that was an audience we'd never even considered before because why, I don't know, it just didn't really cross our minds at the time. And so trying to figure out the best ways to kind of keep it flexible enough for people to use while also, not diluting that message and maintaining that core has been a big issue. Well, not issue, but a good problem to have in actuality. So right now we've been working with a New York State Office of Mental Health for something similar, essentially where they have put out a proposal process for their small coalitions to take that Be the One Team message and sort of figure out how to customize that for their own communities. And I think this is particularly interesting because we work on a national scale, we're not necessarily as equipped as a center or a smaller coalition to really reach a very specific community of people and sort of really integrate that message to the people that would be the most likely to use it on a day-to-day basis too. So your discussion about trying to find a way to really reach your very specific community is really interesting.
So I think to add to that, we knew that hashtag Be There was going to be in place for DODVA, Be the One Who was going to come out again and be the focus. So we wanted a hashtag that could also work with those and not compete. So it can be there, call, text, and live. Be the one to call, text, and live. And so we're trying to work with what was already existing so that, everything can work together. It's not one doing it better. It's collaboration and then having unique, specific things to us as a crisis center serving our community that will then open doors for our local community to see what's being done in other communities. So for us, it was really important that they work together and not be completely separate.
Yeah.
It's really cool, and especially because it not only does it work in tandem with the other hashtags, but it's its own call to action, which I think you mentioned this, and obviously this is a piece with the Be the One Who campaign, but that's a core focus, is giving people a concrete, actionable thing that they can do with PRS CrisisLink's editorial calendar and with the stuff that they're doing all month. It's education. There's an assist training. Almost each one of these things has a link attached to it. So it really encourages people to interact with it throughout the month and gives them an easy way, like you were talking about, decreasing those barriers to participating and increasing the access that these people have to all these different resources that exist out there. Obviously, Be the One Who is doing a lot of the same things. We're putting up all these, the 5 steps, but we're also encouraging people and calling them to submit their own customized things. So it's really cool to see this shift from just like, okay, it's National Suicide Prevention Month, now what do we do? To like, here's exactly what we can do.
Yeah. I actually wonder how you came up with all the items in your calendar, because honestly, like, developing a full calendar is really difficult, and trying not to repeat yourself every single time is difficult too. So how did you do that?
For us, it was looking at some of the more significant risk factors in our local community and what messages were most important to us to educate about. So we wanted to make sure that there were some items for people who maybe have understood the education but needed to know what to do next, which is where our assist came from and or what you can do to help prevent suicide came from. But then we also want to do some more general focused statistics for people to connect with. And for us, at least, well, me, and I felt like there's a lot of people who just don't know where to look, and if that's just their action item for the month, just to read a fact sheet, we've done something. So that's kind of the stages that we were talking about earlier with involvement, like how involved are people really going to want to be? And some people really will just click the links and that'll be it for them, but it has to be meaningful, which is why we chose the links that we did for those particular fact sheets, especially ones and priority populations that are bigger issues in our community than maybe some other communities. The other part was for us to remember that resiliency and distress tolerance and coping skills are critical in prevention, and we wanted to make people aware that there are other things that they can do to help prevent suicide that are not necessarily a walk or buying a t-shirt, but things you can do to take care of yourself if you're struggling or if you're caring for somebody else who is struggling. Those are preventative measures as well. So we're really trying to get more of that public health approach in this, looking at all levels of prevention and how we can make that, we can transmit that into the community at whatever level they're willing to participate. It was not easy to determine which ones are most critical because we are well connected in that we do have a wealth of resources and information and knowledge that we wanted to share, so it's kind of harder to narrow down specifically. But we just basically started out with a long list of resources and then talked about what are we hitting for each really important piece of this puzzle to make sure there's something for everyone. And then we also wanted to make sure we were hitting on donors so that they had an opportunity to give in a meaningful way to them, whether it be in memory of somebody or just because they want to support the cause, but they really don't want a t-shirt or they don't really want to do a walk. It was important to us to engage our funders at that level to show like this is not just an awareness campaign, we're also trying to provide support to our resources as well.
Cool. Yeah, that's great. You mentioned like kind of gauging how like levels of participation from different groups of people. Is there a way that, like, how are you able to determine that? Is there like a specific way you were able to measure that, or is there any kind of tracking that you're doing for this?
Well, we kind of have a sense of our past couple campaigns, how many people are willing to show up to things and how many people are willing to buy a t-shirt. And so I feel like at this point we have a pretty good sense of what we're going to get from each bucket. And we just keep pushing it out further and further to more and more people to see what that does. But I think with our organization, we are a merged organization. So PRS Inc., Psychiatric Rehabilitation Services, is our kind of our parent to more program. And PRS is primarily supporting various mental illness, substance use disorders, and social disabilities. They're very much focused on the mental health side, and suicide is still kind of new. And for us, their donor base and their audience is primarily about mental health, specifically in those areas of mental health. So for us, it's been slow, but fortunately we have great leadership and amazing board members that are really trying to expand and show that audience that suicide prevention is a component of that, and it doesn't have to be scary. So we've been kind of doing it very delicately, which is why this calendar is really critical, because we are saying the word suicide a lot, which is maybe more than they're used to, but it's easy enough for them to click on the link and learn about it without it being threatening or scary or overwhelming. And so that was, for us, our first time really focusing on suicide and not just kind of putting the mental health umbrella over it was important. And this is just kind of the safest way we could do that for them.
It seems like too, because this is something that that I was really happy to hear you say too. But I imagine that framing it in that public health umbrella, under the umbrella of public health, probably helped on a number of different levels, both with your parent organization, but also you were talking about earlier in the community. There are a lot of people who aren't comfortable talking about it in general. So when you are presenting it as these are the stats, this is how you can help, with a very public health approach, getting them to click that link is a massive success. And just exposing them to the issue as a whole, and then potentially providing them with some education. That's awesome. It's really cool.
So I'm a public health person, and working within a community that's very much a fan of the medical model has been a challenge. But this is our one big success in this effort is to really get on board with just that. The clickable links is a huge piece of it. We've seen just in the past year or so a nice turn with our volunteers, with our community events. We are being approached more and more because we are using that model versus the medical model. We're not talking about the treatment methods. We're talking about how everyone can be part of that. And I know that's been really hard for our community. It's probably hard for a lot of other communities where we're talking about actionable items for every person versus only the doctors, only the psych, only the hospitals deal with this issue. So we've seen that, but it's been a few-year process. So I appreciate the feedback on that because it's been a tough turn.
Yeah, I actually think that the direction that that's going in is great, and I feel like it's sort of really well suited for the internet era, essentially, like saying you don't necessarily have to be a specialist or take somebody to a particular place, but this is a DIY ethos, essentially, that we're kind of taking advantage of, which is hugely internet-y, right, where you have meme generators and any one particular person can make a big video happen, for instance, and by saying like, hey, like we're tapping into that, I think is really a very uniquely internet kind of thing to do, and us saying like, hey, like, there's so many tools now for people to make something themselves, web videos, graphic, things like that, so it's no longer sort of a big ask as it might have been in the past to say, hey, can you customize something? Can you push this kind of message out and find a way to do that, because people are already doing that on their own.
And one of the things that you mentioned too, Frances, was just like, how do you evaluate, how do you track some of this stuff? Mm-hmm. And what I think, because of the ways that we're using social media and the internet in general, like if we're tracking at all how many people are logging into the website or visiting our website for a certain campaign period, we are immediately fed with some information and basically real-time data saying whether or not this is working. Facebook tracks likes and how many views videos get. I think Twitter has that option as well. So I mean, and then you can also track hashtags, right? Is there, Frances, do you know of a way to do that?
Yeah, there's actually a really cheap option if you're hoping to do that called hash tracking, which can do up to a certain number of hashtags for you for free, and more if you're willing to pay for the service. But that's actually something that we built a lot of the stuff for the campaign with the knowledge that we were going to have to figure out a way to determine if it was working. And I think to a large extent there's no way to really guarantee something is working, which is sort of like the great boon and bane of doing an online campaign to begin with, or any kind of messaging campaign. But we not only do we essentially track website visits, we're also able to check downloads of kits and buy specific kit in real time, so we can see which ones are doing well, and then take a lesson from that in terms of what kind of look or feel is working. We've also tagged all of the links that are in the message kit if they come back to our site, so that we can see if somebody's been to a page, did they get there from something we wrote, or did they get there from somewhere else? And trying to determine what to do with that information essentially once we have it. So we'd rather kind of operate from a idea of having as much information as possible and then using that to tell the story of how it went, and what we can learn from that. And sort of, I'd rather discard information that turned out to later on to not necessarily be relevant or needed than to realize later that we wanted to measure something and didn't have the opportunity to.
It's really, really cool.
Yeah, you're gonna get that report, Chris, and it's gonna blow your mind.
We're in a new era, and
it's a little scary when you think about it.
Yeah, but you know, again, the really nice benefit that we do get is that we can see what's working. We can try to adjust if we need to. We get feedback. People comment on this stuff. So it's just an interesting way to interact with people that I don't know that we've really taken advantage to the extent that we have at this point.
Yeah, and I mean, anytime we post that, we have a very big Facebook community, for instance, and they do not hold back on their thoughts or feelings at all, which is great. But, you know, we will get real-time feedback from people, and, you know, we try to figure out what to do with that. So I remember, Laura, you're mentioning how to customize something for loss survivors, and that's a fair remark that we've gotten about Be the One To that we're trying to find a way to really address. You know, and it may just be that for us, while we will have material for loss survivors, if you're putting out action steps, it may not necessarily be for that community, but finding a way to kind of distill that message or take the most important points of it and make it more approachable for that community is really important. Is there like any thoughts you had on how you did that?
I was just thinking, for us, we're still kind of working out of the older suicide is preventable message, and that is really what is in direct conflict for loss survivors, because you end up in kind of a debate over whether or not suicide is preventable versus a conversation moving forward about how we can work now in this very moment to help others. And I think for us, what we've really been focusing on as an organization and as a community has been, it's everyone's business, but at the end of the day, what we're really talking about is human connections and how to care for others, and bringing it back to that very simple concept that we have to have community first, and in order to protect our community, there's things that we all have to do, and with different perspectives about how to protect all people from suicide behavior. So we try to move away from, is this an activity that's going to be about loss or prevention, and more about activities that are about holistically supporting a community that's at risk, and trying to change that conversation versus getting into the weeds about who is this for and who is that for and how is it going to support. You have to do part of that in program planning. You have to think about the needs, but we're really trying to break down our message as a more like palatable message that everyone can get behind. And again, we could come back to actionable items. In our kind of ideas about actionable items, it doesn't matter your relationship to suicide, and I think that that's critical into breaking down some of those barriers, which is like, I don't need to know this or I don't need to know that because it doesn't affect me personally. But some of these things aren't really about you personally, and that's what's great about it. It's approachable for everyone. But that is, it seems simple when we look at it, like laid out, but the complexity of what we're really talking about is how do we work around the stigma and get to a place, a common ground without a moral debate or these other things that come in any prevention work, but specifically suicide prevention work. So that was really our goal, and we've been testing it out well before this campaign in our community with our volunteers. One thing that I've been really stressing on just in our interview process lately has been CrisisLink is coming from a public health perspective when we're dealing with suicide. So part of our interview process is we're going to talk about suicide, you and me, and making it like that this is kind of the norm, that doesn't matter whether you're out there or in here, everyone's at risk, and we're going to talk about it. And kind of watching our community respond to that gave us a sense of safety that this was going to be okay, as we started to push it out further with this campaign. So there's been an evolution, I think, for us about how to address that issue without getting stuck into the debate of whether suicide is preventable or not. And for me, like, one thing that participating in this webinar is to encourage centers to do that, to do that work well before September, to find out what their community can tolerate before they shut down, and to start working with that language, making sure it's consistent with what the Lifeline is pushing out, with what AAS is pushing out, or the National Council is pushing out. How much can your community tolerate before it can't handle much more, and then work with those activities to connect with them on their level. Sorry, that was long.
No, that was awesome. Like I'm like thinking it through.
Like taking mental notes.
Yeah, I'm like, all right, yeah, no, that's great. And actually, I really like your stress on the connection angle, because we've been discovering that that is what works for us too. When we get asked by the press a lot, and by individuals who reach out to us saying, like, what can I do now? Is there even anything I can do? And that's when we can say, hey, actually, we've got some really awesome steps you can use. So when we say, blueprint, when we say guide, and when we say what helps is social connection, these are all concepts that they already understand, and that they already feel, and that are actually already floating around in terms of, every article that in the Times or the Atlantic that tells you we are suffering from a dearth of social connection. So, we're tapping into that terror too, and saying that, and none of those phrases necessarily involve the word suicide in them. And we, it's in our name. So I think that's sort of how we kind of get away with not necessarily always having to say it all the time, but kind of making that message more accessible, for sure. I definitely agree with.
Yes. And like one of the other things too that we've mentioned, but I just kind of want to reiterate, is that that these campaigns in particular, and I think for really any kind of successful suicide prevention, mental health, or even public health campaign, is making it possible for people to interact with it regardless of their status or their education or their profession. So obviously with the Be the One To and looking at what PRS CrisisLink is doing, these aren't things that require you to be a mental health professional to play a role, right? And that's one of the biggest parts that I know Be the One To puts forth too, is that you don't have to be a psychologist to save a life potentially. We're not asking you to sit there and counsel this person for the entire month of September. That's not the point of the campaign. The campaign is to reach out and be there and ask the question and take the 5 steps and then hopefully save a life. The things that are on the editorial calendar that you all have created, Laura, are very similar. Like these are little things that we can all do. It doesn't require you to have a certain background or be prepared in any sort of long-term way.
And I would say, too, that one really critical piece of this is having a media partner for smaller centers. We have a local newspaper that's willing to work with us and support us and promote throughout the entire month through ads, through small little snippets of editorials that we're doing. So for us, it's really critical because we really can't, and we're direct service, so it's hard for us to get out and do all of those other things. And so our media partner, the Connection newspaper here in Northern Virginia, has been huge in supporting our work that way. And it wasn't necessarily a difficult relationship to build because we did make suicide prevention more palatable because we're talking about stories of hope and recovery versus kind of the scarier parts of suicide prevention. And they like that, and they like promoting that, and they really appreciate the volunteer service that we're offering in the community, and that it's easy for them to promote activities for us. So, it's one more thing just to add to the list. If you are a center who's considering kind of expanding your efforts, talking to local media, maybe not, necessarily TV stations, because that can get a little harder to build that relationship, but starting with newspapers and print, will also reach a different demographic than your web campaign will. So that's been really important to us too, and I didn't want to forget that because they've been awesome and they deserve a lot of credit.
That's a really, really important point too, because if you're working with those types of partners, they're probably they may be more familiar with reaching certain audiences, or especially reaching their audience. They're going to know what their readers want to listen to. Scott Poland, one of the writers of Suicide in Schools, has talked about how when he started doing some trainings in schools, and he advertised it in a way that was very suicide prevention heavy. So if he said suicide prevention in schools, he would have maybe 2 parents show up. But if he phrased it just slightly differently, like mental wellness or mental health in schools or students' mental well-being or whatever, he would have 50 people show up. And so like having a partner that knows how to kind of finagle some language and make it sound good enough for their readers while still containing a lot of that really important information, that's a really, really good point, and I'm glad that you brought that up.
Yeah, at the same time, I want to note that I don't think any of us are really advocating that we run away from the word suicide or from mental health at all, because since destigmatization is such a huge part of our work in general, it's more like being able to get your foot in the door and then leading people to that other conversation.
Yeah, absolutely. I didn't at all want to imply that we should stop.
I know. I wanted to before that ever took root.
Yeah.
Chris Maxwell told me to not use the word suicide.
Yeah, let's wipe our campaigns with the word. No, that's an incredibly good point. We want to make sure that we're not trivializing anybody's issues, that we're using the word suicide, that we are trying to get people used to hearing it and talking about it and being non-judgmental and not bring biases to the table when we're helping people who may be in crisis. So yeah, absolutely. Now, like we only have like 10 minutes left, and I want to make sure that we leave a little bit of time for questions if anybody has them. But if either one of you, and I don't know who to start with necessarily, but if there was like one really big tip that's really important when getting started with this type of campaign that a crisis center can take and use, what would that be?
For us, I would say partnership. Having a foundation, a collective group of people who are willing to support and promote this message is critical. We are really fortunate in that we have a lot of public mental health centers that work with us directly. So it's, going in, we're an access point, but we have all these other really great partners supporting our work and collaborating with us to make sure we're not missing anything. Our local public mental health, our community service boards, so Fairfax County, Arlington, these are really powerful influencers about the messages that we're promoting about suicide prevention. We have our local health department, things like that, making sure those connections are stable and willing to do this work makes the crisis center work so much easier. And we produce content and they push it out. So they're reaching a much, much broader scope than we could necessarily do as a smaller crisis center whose primary function is the direct service piece. So collaborative efforts is critical to be successful.
Cool. I think for me, in developing what a message is, I mean, not even a campaign, but just a public message, listening to the kinds of things you're being asked for and using that to determine what your path should be. So what are the questions you're getting asked a lot? What are the things people are asking for all the time? That shows a need for something that you might be able to fill or answer, and then build a message around that later on can be turned into a campaign. And that may be similar to what a lot of other people are doing, or it may be unique to your community, but you'd be able to identify that and what's best for you.
Yeah, that's awesome. Really listening to what people are wanting. I mean, it makes sense. You want to give them what they're going to interact with and they're going to engage with. I think for me, really quickly, I think one of the biggest things that I've noticed too is just making sure that you listen to the feedback that you receive and that you try to either improve on or modify things if it makes sense to do so, and try to make things better in the future. Just because if it's clear that, and if people are giving you feedback about something that they either really like or they really don't like, you should probably listen to it. I think, and if somebody wants to jump on, if anyone's on the conference line and they have anything interesting going on that they want to talk about, feel free to do that. If anybody has any questions for us that they want to chat in with, feel free to do that as well. And in the meantime, thank you again both so much for jumping on and helping out. I think this can be really daunting at the beginning of trying to come up with some sort of campaign for National Suicide Prevention Month, or really anything that we do as crisis centers or as larger organizations surrounding suicide and suicide prevention, taking a lot of these things into account. How are people going to handle the word suicide? What sort of activities are we going to provide for communities? What's our hashtag going to be? There's just so much that goes into these types of things. So thank you again for just giving us all the wisdom and knowledge that you have.
Thank you for having me.
Thanks for having us and setting all of this up, and for everybody for joining.
Anybody has any questions, feel free to jump on. Or if anybody wants to, if anyone's excited about what they have going on this month, we want to hear about it. Not one person is excited about what they're doing.
Oh, we have some stuff.
Yeah, Andy asks a really good question. Any advice, and I think we have a little bit of experience with this. Any advice for helping to reach rural communities? I know. So a lot of people in rural communities are hooked up to the internet, and a lot of people have smartphones. So I think social media is going to be a major player there. Mm-hmm. And again, looking at your audience and who you're talking to. So Facebook allows you to target certain messages. If you have a budget for Facebook messaging or Facebook ads, that could be one way you go. You can target specific geographic locations or things that people are interested in, and targeting messages that are culturally sensitive within that might be one way to reach that community. Billboards are still a thing. I don't know if how people feel about that, but I know that out in Montana just had a really big campaign a few years back focusing on men's mental health, and they used billboards to hook people up with a crisis number that was separate from their normal crisis number, so that way they were actually able to track all of the people who called in specific to that billboard campaign. Mm-hmm. So billboards, right. Yeah.
Yeah. I think also emphasizing self-help, self-care, and the DIY nature of a lot of these tools is important, because a lot of these communities may not necessarily have a mental health program or easy access to those types of services. And also those communities can be very insular. So stressing things like confidentiality of a service, tapping maybe into if there's a main occupation in that particular area, working with those groups more specifically to cater something to that particular organization or that group of people might be one of the ways to go about things too.
Yeah, that idea of empowerment is going to be huge for rural populations. That's something that's very valuable to a lot of people. And emphasizing the fact that you can help your neighbor or your friends or your family, and that the Be the Ones Who campaign is a perfect spot for that to fit in. Laura, there's a question down here for you. Yeah.
Great question, Annie. It's something that we've been struggling with a lot about whether or not to use volunteers or even our videos sharing information about us. And something that really clicked for us and changed kind of our perspective on this was the power of lived experience, and really trying to think about that more critically as a crisis center and how it can be a powerful tool with the consent of the crisis worker. So in part of our packages, we ask people when they first come to us if they're willing to use their information in video or photos. It's just kind of part of our standard onboarding process. But then we have guided questions. So focused questions that are about why we're doing the helping versus more real personal deep stories about our lived experience. And it kind of serves two purposes. One, to reduce stigma and shame around going from lived experience to a helping role, because a lot of people think that's not possible. And it also shows the community that we are them, that we are people who are living and working in their communities. We are a representative of them, and the reason people reach out to crisis centers is not necessarily to talk to a medical professional, but to talk to somebody who gets it. And so we're really trying to get at that message through that. But we're very cautious and careful about what that looks like and sounds like. And then we have kind of some guidance and rules around what that looks like. But if you're ever interested, reach out to me. I can tell you a little bit more one-on-one what that was like for us, that transition, and see if there's anything that you would want to learn from us and kind of our trials and errors with that in the past few years.
Awesome. We are at 3 o'clock. Thank you again for joining us. I hope you learned a lot. I hope we have some room to grow on our campaigns and some things and ideas to take back and start working on immediately. So if we need to answer any more questions, or if you have anything that comes up later, please feel free to email us. Francis, your email is?
Mute, sorry. They want to send out any questions to communications at mhaofnyc.org, and then you'll get all of us.
Yeah. And Laura?
I'm just going to type it, and everyone can get it there.
That's a good idea. I'm going to do that as well. There's communications, and mine is yes, Barbara Franks mentions one thing really quickly, and she's been really good about posting these types of things on the Facebook page, or on the Facebook group for the network centers. Taking photos with volunteers or staff, or any of those kinds of photo opportunities, and using those for social media and other things that you have attached to your campaign is a really good idea. So thanks for bringing that up, Barbara. Okay, everybody, it's been awesome. If you have any questions, feel free to let us know, but otherwise, have a good afternoon.
See ya.